Um, just one question is, actually, I had been asking similar question like place after place after place, wherever we had been going. Uh, the question is actually, so as you have said, there had been a lot of doctors, nurses, and other personnel, NGOs, a lot of people uh, coming to Haiti from Korea. And in many cases, just as you said, uh, not as much as prepared as much as people wish it for. Sometimes, so and but it seems like we are having growing interest, people, money, and quite amount of resources as well. And in many cases, uh, not as much as the place like here, but quite amount of institutional support as well. Maybe like I think like 10 or 8 very large university hospital have sent like huge teams. I think you have seen some of them. But and they really work hard, as you have seen. You have told me that how Koreans really they know how to work hard, right? But I guess we need the many of the Korean teams do not have a lot of experience for one thing, know-how for second, and as for resource, even though they bring some quite amount of money, they can raise like some from like $100,000 to $1 million sometimes. Some of the NGOs raised like up to like $5 million or $7 million. But that amount of money sometimes is not enough to have like very appropriate capacity, like pre-positioned equipment and resource, or having like their own kind of plane to fly in on time. But still we have resource and money and personnel, and we have a lot of like especially we have a lot of medical personnel who can be of at the service. And what if? And I was wondering what you might be suggesting of possible collaboration or corporations. Maybe something that can be pre-arranged, so not something like like making phone call like after not the day after earthquake, but something that we can kind of like make a pre-arrangement agreement about. Let's say if something strikes in country X, and if it is near some place, and if we have like some resource, maybe we can work together. Johns Hopkins may be able to provide something with experts, with some NGOs, but with if there is some team of medical personnel, like 10 or 20, with some amount of medical equipment, and actually we are getting a lot of donation from pharmaceutical company from Korea as well. So if they are able to mobilize some of that and come there, what kind of cooperation or kind of like collaborative works do you envision that might be possible?
I'm sorry, my question is somehow related to his, so I'm just gonna ask right away. I'm curious, other than your medical staff, what other resources did you need most, or you think will be helpful in the future?
So, there's two somewhat different things: the medical response and the public health response. So let's talk about the medical response first, and then we can discuss the public health response. So the difficult thing with medical response, once again, is logistics. And there's very few NGOs that have the capacity to do true logistics. MSF, Doctors Without Borders, has a budget of $200 or $300 million a year, and they're able to do it. International Medical Corps has a budget of $20, $40 million a year, and they're not. And so the amount of money it takes to have logistics is huge, because if you're going to respond to an acute event like an earthquake, you have to have a lot of pre-positioned, pre-prepared, pre-everything, which pallets of medicine and food and water sitting around. You have to have your own transportation system because planes going into like Haiti in particular were very difficult, and people were using FedEx planes and military planes and stuff. So the ability of an organization to provide completely separate services in a disaster is almost impossible. And most organizations are not very good at it because they live every day by grants. And so IMC, just as an example, gets $50 million a year for grants. Well, 47 million of it goes to doing the grant in Somalia, and doing the grant in India, and doing the grant, and they have their people scattered all over the world, so that when an event occurs, it's not like they can suddenly say, oh, here, I'm going to take $1 million and I'm going to go do some stuff. And I'm just going to pull all my people out of the field, because they can't do that. And so there's very little overhead in NGOs to do response in general. So it's a very difficult proposition. So my belief is that providing additional capacity to these groups through medical or public health expertise is an excellent solution for all of them. Even the federal government, even the UN, does not have the capacity. After the event, the UN has 50,000 people around the world. They all have other jobs to do. And so it's not like they can suddenly say, we need 700 people to come to Haiti and run the show. And so they struggle with those types of things. So by providing a pool of expertise with capacities, and the capacities that are most important is knowledge about disasters and response, experience if possible, and then maybe some basic supply things. But you have to be careful even about medicines, because the medicines you bring over may not meet the medicine requirements that the UN has established as standards for all events. There's very specific standards. And they may be labeled in Korean and no one can read them. And they may, whatever, there may be all these variables that make it impossible to use your supplies. So you have to be very cautious about even supplies. But the human capacity to respond to disasters around the world is very limited, very small. And increasing that pool of responders, I think, is an important thing. In this review I did for the federal government, we had 7 major recommendations for the federal government. And number 5 was, you need to increase your human capacity somewhere. And we suggested to them many ways. They could use retired federal employees, they could use military personnel, they could use volunteers, but even our federal government, the big U.S. government, was unable to provide adequate people into the response. And so I think human capacity is the most important, and I think knowledge is the most important aspect of that.
I don't have that's a big